For the longest, doctors have been telling me, it's not gonna happen, it's not gonna happen, it's not gonna happen.
I took this pregnancy test and it was the faintest little positive.
The pregnancy went normal up until about the end of month 5.
But that's when I started to really recognize that there was something really wrong with my body.
And they're like, you have COVID.
I woke up and I was bleeding as if it was a period. And then I started having contractions. And I was 23 weeks.
But while they were prepping me for the C-section, they were putting me on the ventilator. Like everything went downhill from there. Like I was going into respiratory failure, my kidneys were shutting down, and I was going into cardiac arrest.
I also don't know if my daughter's alive at this point.
I'm Morgana. I'm a humanitarian, photographer, and filmmaker. And this is my husband, Jaco. He's a helicopter pilot. In 2014, we were living in Liberia, West Africa, when the world's largest Ebola outbreak erupted. I helped PCI Media share Ebola survivor stories through radio, TV, and social media, reaching nearly 10 million people. It helped curb the spread of the virus by driving changes in attitudes and behaviors. I saw the impact the storytelling had on communities in the middle of the outbreak. So when COVID-19 started spreading where we lived in 2020, we began documenting and sharing stories of COVID-19 survivors in New York to spread awareness about the disease. But we decided that wasn't enough. We wanted to show how COVID-19 is impacting people across America. So we moved out of our New York apartment and we moved into a 19-foot trailer so we could document COVID-19 survivors in all 50 states in America.
Yes, use it. All right. Oh, and he's out.
I had anxiety as a kid because I was having this reoccurring nightmare that I was pregnant. And this is where it gets really weird. It always was in a very dark time in the world. There always was a level of pandemic. I always was feeling isolated. Always had a lot of questions of how did this even happen. My baby would be born in the dream and wouldn't be able to breathe. So when I was pregnant, when it actually hit, it felt like the beginning of that dream. And what was hard was that pregnancy had always been a fear because of that dream. I was a wildland firefighter, and that's where Marcus and I met. We very quickly were really good friends. You're not supposed to have relationships on fire, so we stayed crewmates for a while. A regular day of fire would be me and my 45-pound pack, and in temperatures of, 80 and above. A lot of hiking with a lot of weight. Even into the beginning of my second trimester, I would be able to hike like 7 miles a day. It was getting to be really, really difficult then, and I was pushing myself through a lot of not feeling right with my breathing. But that's when I started to really recognize that there was something really wrong with my body. this. It's a letter from Maternal Fetal Medicine, dated January 27th, 2021. Re Leah Bossler. Memorandum to whom it may concern. As you may know, Leah was pregnant and recently delivered. Her original due date was 5/6/2021. However, Leah's pregnancy became significantly complicated, at which time she was hospitalized until she ultimately delivered an extremely preterm infant at 25 weeks and 1 day. Her baby is currently in the NICU and will be there for a few months. Here is a newborn diaper. It's fairly standard. This is the next size down. It's a micro preemie diaper. But Mason was neither of those things. She was a nano preemie. So this is the same size as her first diaper, same thing. And it looked ginormous on her, like giant. To explain to someone that your baby was 1 pound 6 ounces it's a size that they don't really know how to register for a human child. But yeah, this is the diaper size for a 1 pound child.
Wow.
And that's big.
I had what they call PCOS, which is polycystic ovarian syndrome. Women who have it just find it very difficult to conceive. For the longest, doctors have been telling me, it's not gonna happen, it's not gonna happen, it's not gonna happen. And it's like, okay, I'm going about my life, and then, just out of nowhere, it happened. End of October-ish, my daughter's father and I were out to breakfast, and it's just like, I feel like I got a migraine coming on. It's like feeling kind of nauseous. I'm trying to measure the distance between our table and the bathroom because it's just like, I don't feel good. And he's just like, are you pregnant? And I'm like, no. But it just kind of like piqued my curiosity. It was just like, well, okay. I'm a little late. Okay, well, take the test. And the test came back positive. I'm just like, oh, shocked the life out of me. Went to the doctor. The doctor was just like, you are about 13 weeks at this point. It was like 13. It was like, I'm almost into my second trimester. I was excited, but I was nervous at the same time. I wasn't quite ready to give up my selfish lifestyle yet. I wanted to work 18, 20-hour days. I wanted to just be able to hop on a plane and go to Vegas, but I gave it up for her. So it was worth it.
The day Marcus went back to work at the resort where he's an assistant transportation manager at, was his date of exposure to confirmed positive cases from work. And that entire department ended up being positive. You could get a test in Western Montana, but there were so few test processing facilities that those immediately got overwhelmed. So our test went to several different states, several different labs in different states. Marcus and I got our test results 16 days after we took the test. I think the head cold factor really hit us first. I might have had a short fever, but it wasn't the kind of fever spike and then sustain that happened to a lot of people. The brain fog was terrible. My body aches felt like my spine was exploding from the inside out. The pain would be centered in my spine and it'd come all the way down my nerves. And anytime I would move my spine, it would just feel terrible. Then my vision would go kind of blurry. I'd be super sensitive to light. I lost the feeling of my right leg and kind of like the ability to use it for a whole day. I stopped being able to form sentences. That was a really scary one. I'd start a sentence, I'd explain to Marcus, hey, I think I want some, and I would just like get super distracted by like an inanimate object and just lose where I was. The fatigue was so bad. I got to the point where I couldn't stay awake for very long. I'd be too tired, I'd have to go back to sleep. And Marcus he started watching me sleep after a while, and he'd be listening to me breathe, and I would stop breathing, or I'd get these huge gaps in my breath. That was the beginning of me kind of recognizing that it was a little bit different than what everyone would say of like, oh, if you're young and healthy, it'll just feel like the flu, or it'll feel like a bad cold, and you'll get over it.
So pregnancy went normal up until about the end of month 5. That's when I started noticing like real bad swelling like in my legs and feet and stuff. I'm walking the floor at work, and it's just like, you know, my legs and feet are just super, super swole. It was kind of like the Elephant Man, like how his limbs and stuff like that. That's how my legs and feet were looking. Eventually, I just ended up buying some Crocs in like a size 10 in men's, which is like a huge shoe. But that's what I had to use for, you know, for my feet to fit in. And that's when the doctors noticed like an increase in my blood pressure. That was the one thing that when I was pregnant, they just could not control, was my blood pressure. It was like before, medication was controlling it, but once I got pregnant, it was just like they just could not control my blood pressure, no matter how many medications they had me on. I went in for a doctor's appointment March 16th, 2020, and my blood pressure was like 180 over 99, and the doctor was just like, you're going into triage. They come in, the nurse was just like, we're gonna find you a room. I'm like, a room? For what? She was like, oh, we're gonna keep you till you deliver. So a couple of days later, they were like, the nurse comes in and she was just like, I hear this rattle in your chest. She was like, well, we're gonna have x-ray come up. They're like, well, it's pneumonia. And they're like, you have COVID. I believe I got it at work because I work in an industrial plant, thousands of people, and you figure that it's tax time, profit sharing time, signing bonus time. So there's money floating around, people are going on cruises, coming back in and out of the country, you know, all of this stuff. So it was just like, then we're all coming back into work. We're just a cesspool of germs.
In fire, in general, you have to take every opportunity you get. So I went right back to work. I didn't ever stop to ask myself, do I feel good enough for this? I came back from that first role and I had some time here, and I realized I hadn't had a period and that I was like 2 days late, I think. And I had, before this, had a Paragard for, I want to say it was like 4 years. No problems with it. I was like clockwork with it, and like super consistent. I could know exactly when things were gonna happen, how they were gonna happen. It was great. So to be 2 days off was like, that's strange. But I had just had COVID and got straight back to fire. So my body was exhausted. I just had a major infection, which can change your cycles. So that wasn't that weird. But I mentioned it to Marcus, and he laughed and said, how 2020 would it be if you were pregnant? And I laughed and said, there is absolutely no way that is true. And the next day, I thought about it a little more, and I was like, you know, I've been having these other symptoms. Like, I feel, you know, of course, it's hard to tell exactly what was pregnancy and what was COVID, but I feel tired all the time. I get car sick now. I used to never get car sick. I am kind of bloaty, and I don't really understand why. So I dug through the bathroom bin of random stuff, and there was a freaking pregnancy test in there that had my birthday, August 28th, 2020, as the expiration date printed on it. I took this pregnancy test, and it was the faintest little positive. And I looked at it and I said, hey Marcus, this is a terrible joke. I was like, this is a faulty pregnancy test. There's no way I'm positive. I went to work the next day and I thought about it a little bit more, and I was like, you know, if I am pregnant, I have a small window of opportunity to take my IUD out if I want to decide to keep it. And deciding to go forward with the pregnancy as a female firefighter is a huge, huge decision. That, I mean, it is hard to keep a career going with that. I went to Target after work and I picked up a box of pregnancy tests. I had 3 positive pregnancy tests, and I'd had my IUD put in at Planned Parenthood. And so I went back to the same doctor to have them look at it, and yeah, sure enough, there was a little Paragard and a tiny little egg sac right next to it. I had decided long ago that I didn't ever want to be a mom. I didn't ever want to have kids. And what changed my mind is how awesome of a dad I knew Marcus would be. And it just kind of came out of my mouth. I was like, okay, let's take the IUD out. But I still was within, you know, under 2 months pregnant at that point. And there was a certain amount of question of how viable it'd be with removing the IUD. So we were kind of waiting and seeing. But I hadn't told anyone at work. And so I took a helicopter to a really remote, like, quarter-acre fire. We worked overnight through the dark, cutting to stop the fire. It would be very normal for me before, but the next day I felt slow and heavy, and all of a sudden I started to bleed, and then all of a sudden I was bleeding more than it would be for a period anyways. And then I was putting it together that this could be a miscarriage. By the time I got into a doctor, it was like 24 hours after I'd started bleeding. I thought I'd lost it, and went in and we first did a little listen for the heartbeat, and we expected to hear nothing, and all of a sudden it was still there. So we did an ultrasound and everything looked fine. Between that time, from 8 weeks to 23 weeks, everything was perfect.
The 21st, I had spiked a fever, and it was like 99 something. They gave me some Tylenol to break the fever, and it did. The next day, the 22nd, I had a fever again, but this time, like, the fever just wouldn't break, and my blood pressure was, you know, spiking really high. And the fever spiked at 105. Not 100.5, 105. So the morning of the 23rd, I don't really have very many memories of. At this point, I felt like I was in and out of consciousness. My oxygen levels had got super, super low, so it was dangerous for the baby. So that's when they decided, they were like, we got to take the baby now. But while they were prepping me for the C-section, they were putting me on the ventilator. Like, everything went downhill from there. Like, I was going into respiratory failure, my kidneys were shutting down, and I was going into cardiac arrest. She was due May 23rd. She came March 23rd. They tried to take her out of the room like as soon as they could, because I was COVID positive. So they, like, from what I've been told, that the room was only a limited number of people. Like, there was like maybe 2 nurses and the doctor who did my C-section, and that was it. Like, they had to get everybody out of there. She was born COVID positive. She had some breathing issues and some light kidney issues because of COVID and things like that. She stayed at Providence for a couple of days, but because they're just not equipped to have dealt with somebody so small, so new with the virus, that they had to send her to CM in Ann Arbor, the Children's Hospital in Ann Arbor. So they airlifted her.
January 8th, I woke up and I was bleeding as if it was a period. And then I started having contractions. I went in on the evening of January 8th and was told I was in labor, and I was 23 weeks. And at that time, Mason's heartbeat was a little subdued, but not gone, and not at like a panic level either. But the amount of fluid that I was leaking and the amount of blood clot that was coming out that I was passing was very, very concerning. So Dr. Holbrook was called in to see me, and he told us that it was fairly likely that we were going to lose her. Fairly likely that if she were born alive, that her quality of life was going to be at a point where we might need to consider what that quality of life would be. And then he would say there's also the chance you stay pregnant till 40 weeks and everything's fine. But that going into labor at 23 weeks generally doesn't have great outcomes. And I think the number was a 30% chance survival, not even quality of life perspective, but just survival rate for her. So that was rough.
You know, the overall rates of preterm delivery prior to 28 weeks, and she ended up delivering at 25 weeks, so the overall rates of preterm delivery prior to 28 weeks is about 0.2%, so it's extremely rare. And the risk factors for such an early delivery are none of the things that Leah has. You know, Leah was young, very healthy, kind of if you think of someone that would be a great person to get pregnant because she's very unlikely to have complications, she's it. You know, it's interesting because I think she had a number of complications and weird things happen and bad things happen. And I think some of those were related to Paragard and some of those were related to COVID. And there definitely was probably some overlap in the middle as well. I had seen a few cases before Leah, and I've seen a lot of cases since Leah, but none just like hers.
I didn't get a COVID test until that evening on night shift, which came back positive. And that was like a huge, what the heck is going on moment.
At that time, there weren't a lot of cases of someone that had COVID more than once. And so when she tested positive, we said, that's silly, and she had no symptoms of it. So we just kind of dismissed it. And then we tested her again, and it was negative. And we tested her again, and it was negative after that. So at that point, we presumed that she was negative. With what we know now, it does make me wonder, did she have a second COVID infection at that point that was related to all of this?
We celebrated with every shift change of a nurse because it meant 12 more hours. That's really what the name of the game was at that point. We weren't necessarily focusing on quality of life. In our mind, we focused on quality of life second. We focused on viability first. We got to 25 weeks, and that was huge. Then we got to 25 and 1. Because of Marcus's back injury, it was really hard for him to sleep on the hospital couch beds. They're like the worst things ever. I got to the point on January 19th where I said, you know, I don't think she's coming today. I think you should go home and get some sleep. An hour and a half after that, Mason was born. Everything happened so fast. She went away, and Dr. Holbrook looked at me and he said, is it okay if I feel for your placenta?
After a baby's delivered, we clamp and cut the cord, and then we have the cord hanging out between mom's legs, and we pull on that to deliver the placenta. In Leah's case, the cord was very, very small and fairly weak, and presumably due to an infection that she had no signs of infection, but based on how Mason did after delivery, we think that there was an infection there. That presumably kind of weakened the cord as well, and so the cord ended up avulsing, meaning it tore. And so then we had nothing else to grab and pull it out. So we ended up having to go to the operating room to remove the placenta.
I could see the hose of the vacuum that was pulling everything out of me and the tank, the clear tank that all of that went into. The plastic of the tank was clear. Everything in it was red and black. The whole thing felt so traumatic, and I started to panic. I also don't know if my daughter's alive at this point.
My kidneys had shut down, so they put me on dialysis for 24 hours for like 2 weeks straight. I had caught a bunch of other different viruses. I had caught sepsis as well. It just seemed like every time they figured out one thing, I had caught another kind of virus or another kind of infection. and stuff like that. My lungs were already, getting damaged from being on the vent for so long. I had coded like 2 or 3 times. So, then they're trying to bring me back. At one point they were like, well, the baby's gonna make it, but the mom's not gonna make it. Then they were like, well, the mom's gonna make it, but the baby's not gonna make it. They told my mom, like on 3 separate occasions, that she could call who she needed to call and start making my arrangements. It was not looking good. And then what made it worse for a lot of the people who were involved was, the fact that I was so young and I was a brand new mother for the first time. The medications that they were giving me, a committee had to agree on to get them. And at first they didn't want to, but the doctor that I saw, he was just like, we're gonna do it regardless. We don't need the committee. We'll talk to the committee later. They want to fire me, let them fire me, but for right now she's gonna get them. He said that he was gonna do everything he could. He was like, he refused to let this child grow up without a mother. When I came out of the coma, I had a hard time distinguishing between reality and fiction. Everybody was like, oh, congratulations on your baby, congratulations on your baby. I'm like, what baby? I didn't even realize that I had a baby.
The kind of parent that you become when your child is early, when your child is immunocompromised, when your child has tubes, it's not really represented and it's not really discussed, and it makes you feel very isolated.
The other thing that I was really battling with was the COVID fatigue. How am I going to be able to feed every 4 hours or every 2 hours in diapers when I can't even keep myself awake?
Her oxygen decreased significantly, and she lost her color and lost her energy and didn't feel good, and she had to get intubated.